Thank you, Shaji sir, for your warm welcome to me. Am I audible?
Yes, you are audible. If you
Okay,
keep your laptop little more folded so that your face will be, yeah, enough. Fine,
okay, sir.
fine, fine, fine.
Okay, thank you. So, before going to the session, I would like to thank all the organizers of IFPH, that is Indian International Forum for Progressive in Homeopathy. So, first of all, I would like to thank my teacher, my mentor, Dr. Manoj sir. Sir is not only my teacher but also my advisor in each step in my life related to the homeopathy. And also, I would like to take this opportunity to thank all the organizers. I have seen or I have attended one or two sessions of this program. Anyway, I congratulate each and every organizers because they have taken a Herculean task to promote homeopathy all over world. And also thank for inviting me for taking. And also I am very lucky to share and screen with all of you in this section. And also I take this opportunity to thank one of my teachers, Dr. Ajay sir, who has recommended me for this section. And here, when I see the participants also, all of all of the participants, many of the participants present here, I know them personally, and also I have heard them, and I have attended many of their classes. So I am, moreover, I am taking, and before going to section, I am taking an anticipatory bail that if I am whatever thing, I am not an expert in front of you and all, but still, if any ideas you are also having, please you can also share with me. So with that, we'll go to section. I'm not wasting the time. So whether my slides are visible, sir?
Yes.
Okay. So myself, I am Dr. Harishankar V, Associate Professor in Department of Practice of Medicine and moreover in charge of Cancer Pain and Palliative Care Unit of SKHMC. Today's topic that we have decided is that is space of homeopathy for palliative care. Dear doctors, you could all have or you all have aware about the word pace. That is, pace means a step. A step we are taking. That's the meaning of the pace. A step we are taking in the field of homeopathy for a palliative care. Before going to the session, I would like to uh, pray to the Almighty God to take away deadly diseases, deadly diseases from this world, so that no one will be requiring a palliative care. Because it's what is my experience, or before going to section, what is my experience regarding the handling of these cases is we have to face with a smiling face, though we are having and very we have to face it with an hand-heartedly, with a smiling face in front of these patients. So let God take away this deadly disease. So that I pray that no one should come for this palliative care, because not I'm not taking in a negative sense, but in a positive sense, because no one should suffer from these type of deadly diseases. Even my enemy should not suffer from these deadly diseases. That's why with that prayer I am going to the topic, that is the pace of homeopathy for palliative care. And everyone knows the word what is palliative care, because every day to life we are very what we are facing, or what we are seeing is number of cases are coming with palliative care. When we see before 25 years or 20-25 years, we are not aware about this, even this word about palliative care, because the deadly diseases are increasing day by day, and the doctors or medical field is standing in front of these type of diseases without any treatment. That's why nowadays the increasing need for this palliative care is there in the field of medicine. So we will see what is palliative care. So palliative care, it is the palliative care. According to World Health Organization, the statement describes palliative care as an approach that improves the quality of life of patients and their families facing the problem associated with their life-threatening illness. Though the prevention and relief of suffering by means of early identification, by impeccable assessment and treatment of pain and other problems, physical, psychosocial, and spiritual. The palliative care is a multidisciplinary approach and specialized medical care for people with serious illness. The goal of the therapy is to improve the quality of life. It is focused on providing patients with relief from symptoms, pain, physical stress, mental stress of serious illness. So from this slide itself, we can understand that palliative care is the treatment, or it is not an treatment for a curative level. It is a treatment that is given to the patients who is not having further any treatment, or the medical world is standing that there is no cure or no further treatment required for this patient. Only the term itself or the palliative care itself is meaning that preparation. Anyway, the patient is going to in a terminal stage or going to die. That is the preparation of the patient for a decent death. That is a single term or single burst term to define the palliative care. The burst term to define the palliative care is it is an treatment or it is an preparation for the patient for a decent death. So the diseases which demands palliative care. We all know that there are number of diseases. Each and every disease, there are number of diseases having there is no treatment for number of diseases. Even from our each and every vital organ can demand for palliative care. We can know that either that is liver diseases, heart diseases, kidney diseases, then brain diseases. Any disease can demand this palliative care. But the percentage of the palliative care the demanding the palliative care is increasing with cancer. That is 32%. 32% of the diseases that demands the palliative care is cancer. That is also we are nowadays we are telling that if the cancer is diagnosed in the early stages, we can cure or treat the cancer, but still cancer is a deadly disease that the person demands the palliative care at its course of the disease. It also depends upon the type of cancer. It also depends upon the pathology, site of cancer. Everything demands whether the cancer is treatable or not. Still, the disease that is demanding the palliative care is cancers. And the next to the cancer, we can see the respiratory diseases. Respiratory diseases, there are a number of respiratory diseases that can demand for the palliative care. And with that, next is for heart diseases, renal diseases. We all know number of renal diseases we are now today facing with the in our clinical practice. The number of patients are coming with renal failure. The only possible method is to go for the renal transplantation, which is not possible for many patients for going for the renal transplantation. Only treatment available for the person is to give an palliative level treatment, especially to cope up with their life. And according to my experience, also number of renal diseases are also they're visiting our college with the which is demanding this palliative care, and still we are able to provide or we are able to extend their life expectancy with our homeopathic medicine. Next is liver diseases and geriatric diseases, and finally with the 2% with the viral diseases also sometimes demand for the palliative care. In statistical information about the prevalence of cancer. We all know that the disease, the higher amount of disease or the deadly disease that is demanding the palliative care is still cancer. And medical world is still in a dilemma what to do with these cancers. So here in the worldwide, the number of cases reporting per year is 18.1 million in the worldwide per annum. and 3.9 million per cases in India, and 2 points where I am my practice or where I am practicing in our Tamil Nadu, it is 2.22 lakhs cases per annum. These are the number of cases that is reporting per year. Then background of the study: cancer is a major health problem. Cancer incidence and mortality are rapidly growing worldwide. The Global Cancer study estimated that there will be 18.1 million new cases and 9.6 million cancer deaths worldwide. Globally, near 1 in 6 deaths is due to cancers. So, what I am experiencing, that is before, when I am a child, or when during before 25 years or 30 years, before 25 years, when we hear that cancers are something happening to, or this palliative treatment is something happening to somewhere for someone at some place. But nowadays, when we see, it is when we take a street itself, if you are having 10 houses, one or two houses will be having a cancer patient or a patient with a palliative care. That is a nowadays incidence, and the increasing the number. So we don't know. There are number of reasons and number of etiology still we are studying, but we do not know why it is occurring. There are a number of causes still there. We have to go in for research for why it is all occurring. Background of the study: the increasing incidence of cancers approaching the SKHMC hospital led to the necessity of starting a cancer pain and palliative care unit in 2014, and nearly 300 new cases are registered still now, and homeopathic palliative care can meet with. So, what are the dimensions of the homeopathic palliative care? The homeopathic palliative care can meet with easing the pain. That is the main thing we are facing with, and everyone knows that what is the main symptom that is present with a person with an terminal stage. That is the pain. We all know that anything we can tolerate, but pain, it is not tolerated by everyone or by anybody, because without with pain, he is not able to sleep, he is not able to take a food, he is not able to face his relatives, not able to talk with anyone. These all things are going with the pain. The pain is the only main and the important symptom that is faced by the patients with an this terminal care or this cancers. And the palliative care is mainly aimed at the reducing the pain. And one more information I can share with you is, see, before we are starting our palliative care unit, for homeopathic palliative care unit in our college in 2013, the first this Pallium India, one of the organizations that have approached us and started their one of the thing in our college. So they'll be coming in monthly once for treating this cancer. They will be going for home visits. They'll be taking the patients. And what the thing is, they are providing with this. They are doing this allopathic medicine. They are providing the allopathic medicine for them, modern medicine. And the medicine that is given is morphine. I have also experienced with this, or I have experienced with by going with their to with them to the home visits. So the medicine mainly given is morphine. They are having an pain ladder medicine from starting from paracetamol. They are going upward, 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 and till the terminal one is given is the morphine. And whatever the aim of this palliative care, or their aim of the palliative care, is to reduce the pain of the patient. Pain, if the patient is having a pain, they will be starting with the morphine. But see, what I have seen with that patients with this under this morphine, I am not against or not criticizing or not telling anything, but what I have experienced or what I have seen with these patients is, usually when these patients are taking, they will be in semi-conscious state. They are not able to take their food. They'll be what they cannot smile, they cannot do, or they do their day-to-day activities, everything. Sometimes for complication they have to take other medicines. So I would think that what is the use of, because they will be in a semi-conscious state, they will not be crying for the pain. This is the see. But with this homeopathic medicines, what I have experienced is, not only the patient is having the reduction in the pain, but also they are able to do their do their day-to-day activities. They are having no side effects with them. They are able to cope up with their lead the normal, what not normal, but they are able to do their normal activities. So that is the main aim of the palliative care, in enhancing the quality of life. Then only the patients quality of life is enhancing with that. If the patient is, if you are not able to reduce the pain, and if you are not able to cope up with their day-to-day activities, then what is the use of the increasing, enhancing the quality of life? That's why that is the main thing that is provided with the homeopathic treatment. So psychological counseling, then reducing the side effects of chemotherapy. So many patients come to us for after chemotherapy, and usually I'm just not going ahead, but still I'm when I have to share the information regarding that is our medicine, one of the medicine, ourselves. Ourselves is a very, I have also having number of cases that is with after chemotherapy, after side effects of chemotherapy. One of the important medicine we have to think is ourselves. Ourselves, many of the patients have improved with the side effects of these chemotherapy. So, next is aims of the palliative care to give a gentle palliation to the suffering patients in advanced or terminal stage of cancer, to give better treatment by means of effective homeopathic medicines, to improve the quality of life of the people suffering from the advanced stages of malignancy, to detect malignancy in the people and to identify those people who are prone to malignant disease as early as possible, to diagnose the disease and give curative level treatment with the scope of homeopathy. We create an awareness in the society. That is an important aims of this palliative care. In palliative care, not only we are the what we should think that everything is gone, but we have to treat, or we have to face. We know that the patient cannot, or the patient is going to die or something, but we cannot face them. Usually, what are the problem faced by is many of them will be bringing the patient. He will be that hospital told that he will be living only for five days. He will be living only for 1 month. See, many of the patients have taken their life for 2 or 3 years with our treatment. That is one of the miracles that we have to see with this homeopathic treatment. That is a fact. So that's a main aim. We should not treat the patient that either the patient is going for the palliative, so we can do anything. But still, we have to approach the patient that we are going to. Some miracle will happen with this homeopathy treatment. Many of the cases have improved with this homeopathy treatment and led their life. Usually, what the other system of medicine have told that the patient will be living only for 2 or 3 months, have we all prolonged the life for 1 or 2 years. That is a miracle that has happened with this homeopathic palliative care. So these are the activities that are happening, or what doing in our college. That is medical camps. Number of medical camps where we are conducting regarding this awareness. That is cancer awareness. In usually before this our COVID and all, we will be doing at least one medical camp exclusively for this screening camps, exclusively for this what cancer screening, and also cancer surveys, and also medical camps related to that. And usually it will be done with the in association with the different NGOs, and they will be bringing the patients, and also we will be referring the patients. Most of them, those who come for this homeopathy treatment is economically poor patients. That is a main aim also. One of the important aim also, it is we should not economically also, it is very useful homeopathy treatment, because very we all know that it is very simple and also safe and also economic mode of treatment that can be given to the patient. And also awareness programs. We have conducted number of awareness programs, and awareness programs, what we have to do is, still now the public is, what I have experienced is, still now the public is uh, not aware about the cancers, and also aware about this palliative care. What is they think still now is the patients still think that the cancers are a social stigma. Usually, what they do is, if a person is suffering from the cancer, they will not bring the patients, or they will be thinking that we should not let the public know that, or the other house should not know that the patient is having this. So still we have to create awareness for the early detection. That is an important thing we have to do with this awareness program. This is, we are conducting home visits. Home visits are very, because it is very useful for the bedridden. Usually we know that these palliative cases will be usually bedridden. They are not able to transport these cases. Usually we are conducting these home visit programs also in and around the panchayats of this Kuleshekaram panchayats, or in and around the Kanyakumari district. Nearly we are having 100 patients for these home visits, or monthly ones. Every Mondays we are conducting these home visits, and also screening and treatment. These are the activities. So this is our Sarada Krishna Homeopathic Medical College and Hospital. Many of you have, I think many of the doctors have visited our college. one of, as Shaji sir told, that one of the best colleges in India, what we can tell for an homeopathic hospital. And the salient features of our hospital is the hospital is an NABH accredited hospital, and around 500 patients, regular patients visiting per day in our hospital. And we are having the facilities is NABH accredited laboratory facilities, then ICU facilities. Especially, we have started this ICU facility after we have seen the need for this palliative cases, because for the terminal care management and all, we need some ICU facility for this monitoring. And ICU facility also help for ICU management. We are doing with our homeopathic medicines. We are doing with our homeopathic medicines, and what we have felt is it is not only helping for the this management of the cases, but also it is also helping for the prognosis, assessment of the prognosis after a homeopathic medicine administration. There are a number of data. In another one occasion, we would like to see that. So 19 outpatient units, including specialty units such as community medicine, mother and child, pediatric yoga, learning disability, etc., and palliative care center, particularly for cancer patients. And palliative, this is our OPD, and we are having separately terminal care room for the patients also. So we are having separate pharmacy, because we are not mingling this type of patients with other patients, because they need some separation that we are doing. That is, we are having separate pharmacy, separate ICU, separate cubicles for the management, all these separate consulting. Then statistical information of type of cancers in SKHM, palliative care, and OPD unit. What we have seen is number of cases nowadays. We all know that oral cancers, that is, different types of cancers are coming, but oral cancers are most number of cancers that is visiting our OPD. And one of the important reason what I felt is the Kanyakumari district, most of the areas surrounded by the coastal region, coastal area, and usually the persons in this coastal area are having the habit of this betel nut chewing, and the tobacco usage is still very particular in these type of areas. And we are also conducting number of surveys and also awareness program in this coastal areas to make awareness about the harm of, or this bad effects of this tobacco. Still, it is there are number of awareness programs are still needed to make them aware. So major symptoms in all type of cancer. We all know that what I have, especially what before I have told you before itself. In all types of cancer, whatever the cancer is, whether it is mouth cancer, whether it is oral cancer, whether it is the testicular, whether it is GIT cancer, whatever, or colon cancer, whatever cancer, the main symptom experienced by the patient is, or the main important uneasy feature is the pain. That is the main thing. Or see, some type of patients will be asking us, doctor, please, can you reduce my pain? That itself is enough for me. That is enough for me. That is a main, because that is a threatening symptom that is present in the patients with cancer. To the main aim of us, or main aim of our treatment is to, for the palliative care, is to reduce the pain, and further the reduction of the symptoms, and further that is the in enhancing the quality of life, and that will increase the quality of life of the patient. So reduction of the pain should be our main aim. So according to the all know that what is pain? Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. Cancer pain is a complex, temporarily changing symptom, which is the end result of mixed mechanism. Whether it is a disease diagnosis, disease progression, or terminal care, the intensity of the pain is the main thing we have to know. Cancer pain is due to, it can be due to non-receptive pain signals from nerve endings, neuropathic pain resulting from damage to the nerve, inflammatory, ischemia pain caused by accumulation of metabolites as a result of decreased blood flow to the muscular organ, compression mechanisms at multiple sites, visceral pain due to spasmodic contraction of smooth muscles in the wall of the viscera, compressing the blood vessels. So anything, the cancer pain can be due to either due to the nervous involvement or due to the pressure effect. This all can lead to the pain in the cancer patients. We all know that what is the anyone other than homeopathic field is present. We all know that what is homeopathy. We're not going for that. Then homeopathic palliative care needs to help the individual and families to address physical, psychological, social, and practical issues, cope up with the loss and grief, treat the issues and manage the symptoms, promote opportunities for meaningful and valuable experience, prepare and manage for end of life choice and dying process, prevent new issues from occurring. This is the homeopathic palliative care, the dimension that is we have to meet with. So many of the patients will be having, number of patients or bystanders will be coming and telling us, doctor, please don't tell my father or my mother or my whoever, don't tell that they are suffering from cancer. Please don't tell that. Let them not know that they are suffering from cancer. Usually, what they are telling is correct thing, because if someone knows that they are suffering from cancer or suffering from this incurable disease, their life expectancy will be reducing. Will be half, it will be reducing. But the another side of that is, see, if you are not slowly telling that to them, what the thing is, many of them will be having many what they will be having number of what expectations in their life. Somebody will having a feeling that they should see the marriage of their son, some marriage of their daughter. Then they should tell that I have to see a what my grandchildren. I have to see my marriage of the my grandchild. This all number of desires will be there with these patients. So if you and somebody will be having, we have to divide the properties for the children, so that I would wish you to give this and this to my children. See, these all are the number of expectancies that are present in the patient. So if you are not revealing that, so revealing this to the patient, then they cannot prepare their life, rest of life, for what prepare their rest of life for the other activities. So that is the main other side aim we should have. So we should leave, if you are not revealing this to them, they will not knowing that, and one fine morning they will be going for that. But many of their desires will be left without any without this what they will be left without satisfaction. So that we have to revealing is a important thing. So that is the one of the thing is revealing this disease. That is one of the important aim of the doctor, how to really reveal these to the patient. So one of the thing is number of psychological counseling should be given to these patients before relieving. We have to prepare ourselves before relieving the this bad news to this patient. That is the important thing we have to see in the palliative care. So cases, the number of case series data, that is only I am presenting the some of the cases what that is treated by in our unit. That is yeah, it is I just presenting with this some of the case series data. That is one number one. That is Mr. 72 years male patient presented with a CA floor of mouth. Duration is 1 year. And usually here the patient is presented with a painless ulcer. Disability is marked and hemorrhage is present and knee joint pain. Associated complete with knee joint pain. And we have prescribed with muriatic acid. Then next is a patient with an CA bladder. That is the duration 1.5 years, severe pain in urethra. The debility is present, bloody urine, heartburn, and we are present with prescribed with hydrocyanic acid. And next is a patient with the CA lungs, 1 year duration. Excruciating pain is there. Excruciating pain is there, and debility is marked, and hemorrhage. There is no hemorrhage. There's also the breathing difficulty, difficulty in swallowing, and the patient is prescribed with the phosphoric acid. And one of the other condition, that is 65 years old female, adenocarcinoma of stomach, 1.5 years duration. This pricking pain, increased salivation, debility, that is 3 plus, hemorrhage, nil, breathlessness, and heartburn is the associated symptoms, and sulfuric acid. Then another one, 80 years female. It is CA rectum for 1 year. So severe pain is there, and debility is marked. Then hemorrhage, bleeding with mucus and pus discharge, and associated, there is no other associated, and prescribed with nitric acid. Then Mr. V, 63 years old male, CA oral cavity, 1 month, pain and swelling, and debility is marked, and hemorrhage is present, and ulceration and HbA is also decreased, and prescribed with nitric acid. And another one, 59 years old male patient with a CA rectum, 1 year duration, pain, ineffectual pain is there, and debility is also marked, and bleeding and mucus hemorrhage, and also with lower abdominal pain, and prescribed with nitric acid. Then 55 years old female, CA thyroid, 4 years duration, pain with swelling, and associated with diabetes and numbness also, and prescribed with phosphoric acid. And CA rectum, again CA rectum, 3 year duration, burning pain, debility is marked. Then hemorrhage is also bleeding with mucus, distension of abdomen, backache, watery stool, prescribed with nitric acid. Then CA sigmoid colon with metastasis to the lungs, 4 month duration. This pain during stool. Disability is plus. Hematitis is present. Back pain, distension of abdomen, breathing difficulty. Prescribed with phosphoric acid. CA mouth, 59 years old female. 2 months duration. Pain and swelling in cheek. And bleeding is also marked with the pus. And diabetes associated with the diabetes mellitus and phosphoric acid is prescribed. Then CA liver, 5 months duration. Pain is there. And debility is also marked. Bleeding with the pus, weight loss, distension, right hypochondriac pain, present with acetic acid. So these are the some of the patients that we have treated. And see what here what I have what we have prescribed. It is a conjoined prescription, not individually. I'm not we'll be discussing with our senior doctors also. Anyway, what we are doing for the prescription is not an blind prescription, but we'll be taking the symptoms and moreover we will be considering the pathology and also the fear of action. And with that, we have prescribed this. And most of the cases we have prescribed this, or most of this epithelial cancers, what we have seen is mucous membrane. And before itself in the statistics, we are told that most of the cases that is reporting to our college have presented with this GIT cancers. And usually, as groups of the medicine that is coming for, and results when you are seeing that is 80 to 90 years, that is 2 cases, 70 to 80 years, that is 4 cases, 50 to 70 years, 3 cases, and 50 to 60 years, it is again 3 cases. Results distribution by the 5 cases and 7 cases in male and female. Female it is so 5 cases and male it is 7 cases. And results say we can see a mode. It is 3 cases. One case with see a bladder, see a lungs, see a stomach, see a thyroid, see a sigmoid and see a liver. For the distribution by the age of by distribution by acid group of medicine. Most of the cases we have prescribed with nitric acid. Number of cases because see when you see this acid group medicines are having action on this what mucous membrane, and usually we know that this epithelial cancers, especially mucous membrane, usually the type of cancer that is occurring is regarding this epithelial cancers are occurring, and the acid group medicines are having most of action in these type of cancers studying. Acid group medicines are very useful in management of cancer cases, especially cancer of GAT. Homeopathy can not only cure cancer if treated in early cases, it can also act as an excellent palliative care modality. It only not only reduces pain, it helps to improve the life and extending life without doing any harm to the patient. It helps in the mental, physical, social, and economic well-being of the patients. See what we have seen in these type of what are these are the only few number of patients I have shown, but what we have observed in this type of patients is all patients have came to our OPD after some patients have come after the treatment other from the other side, and they have left there told that some there is no treatment for you, or there is no further scope with this cases they have come, and some cases have come to us that they are not willing for going for any chemotherapy or going for any surgery. See what we have observed in many of number of cases is they are not willing they are not willing for the surgery, not willing for this chemotherapy, not willing for the radiotherapy. Number of patients and also economically poor patients also come to us. See in these type of cases also what I will advise is directly I will not tell them that I can cure you or I can give you complete relief or anything. But what I advise is usually I will be explaining whatever the possibilities that is present in our day-to-day medical field, in our day medical field, either with the not only with the in spite of not only with the homeopathy, with the other system of medicines also will be, and the choice is left to them. If they are willing or not willing to go to anything, that only we are going. And also for palliative cases, we do not go for anything. Just we can treat the cases with our homeopathic medicines, and we can just explain or we can tell that what is the use of this or what is the use, what is the benefit of this homeopathic medicines or homeopathic treatment for these type of disease conditions. So commonly indicated medicines, organic acid, that is benzoic acid, acetic acid, benzoic acid, carbolic acid, lactic acid, oxalic acid, formic acid, picric acid, salicylic acid, uric acid, citric acid, and tartaric acid. And inorganic acid, boric acid, chromic acid, fluoric acid, hydrocyanuric acid, muriatic acid, nitric acid, and phosphoric acid. See, what is highlighted here is the medicines frequently that is used in our palliative care department, is phosphoric acid, nitric acid, muriatic acid, hydrocyanic acid, and acetic acid are the medicines that is frequently used or which have given relief to the number of patients. That's why we have highlighted that medicines. The sphere of action, inorganic acids have action at the level of skin, mucous membrane, blood, and blood vessels. Organic acid have action on muscles, tendons, connective tissue, endocrine organs, soft tissue, sexual organs, etc. So the common symptoms, that is mental symptoms, is exhaustion, hurriedness, irritability, aggression, impulsive and relaxed perception, wearing of life, despair of recovery, weak memory, confusion with a lack of concentration, disoriented, aversion to company, drowning with uh, constant muttering. Physical symptoms are burning, extreme weakness, debility, destruction of tissues, ulcers, septicemia, malignancy, hemorrhage, loss of vital fluid, then pseudomembrane formation, oversensitiveness to external stimuli, deficiency, acrid, blood-stained excoriating discharges, loss of air, and brittle nail. These are the physical symptoms, common symptoms. Indications of the medicine. See, we can see, I'm not taking much time. I know that. Anyway, acetic acid, mainly the sphere of action is in the stomach and the chest. And that is especially indicated pathology. It is indicated in the cancer of stomach and the sensation that is like a load. This all will be helping for the differentiation of each agent. We cannot give blindly medicine to with the pathology, because in these type of cancers, usually these terminal cases and all, there will be lacking of symptoms, because usually the patient, only our objective level symptoms are most useful for the prescription, because usually the patient will be suffering from pain, they will be crying, they will be in a semi-conscious state. These all times you cannot sit and take a detailed case taking. You can ask for the important symptoms with the bystanders, but only the objective level symptoms are mostly helpful for the, or what are the observations, or mostly helpful for the prescriptions. And we saw by that we can differentiate these different types of medicines. So the main thing is associated symptoms is hemorrhage from any part, wasting, and debility. Then benzoic acid, its main action is on the kidney, bladder, joints, heart, and bowels, and marked action on metabolism of tumor of the eye. And you can see the sensation, pain suddenly changes their locality, pain alternates with heart symptoms. And important modality is amelioration by profuse urination. Then carbolic acid, its main action is on the membrane, stomach, bowels, lungs, heart, and respiration. And pathology, death due to paralysis of the respiratory centers. And sensation, pricking like needles all over. And associated symptoms is feeble pulse and depressed breathing. Nitric acid, one of the, what I have experienced, one of the miraculous medicine that is present in this, because it has given relief to number of patients with this, especially in the GI cancers, from oral cavity till the rectum. Number of cases have been improved, and also number of cases have given a palliative level relief with these nitric acid medicine, one of the important medicine, especially margins of the outlets. That is advanced stages of cancer with superficial ulcer, that is papillomata, Kaposi sarcoma, all type of, and the splinter. The Kaposi sarcoma, everyone know that one of the important condition that is occurring, uh, uh, especially it is a very, very painful condition that is occurring, and splinter like pain, that is sticking type of pain. And the main associated symptoms is offensive discharge. Then sulfuric acid, especially it is having action on digestive tract, blood vessels. And pathology is, especially it is having action mainly on the glandular cancers, sulfuric acid. And sensation is relaxed feeling in the stomach. Then associated symptom is hot flushes followed by perspiration. That is one of the associated symptoms that is present with the sulfuric acid patient, especially in glandular cancers. Then phosphoric acid, all know that one of the important medicine, especially for diabetes mellitus and also, but this debilitated, before I told you regarding this arsenic album, one of the important medicine after chemotherapy. Next one important medicine is this phosphoric acid, also mainly debility after this chemotherapy. The patients are very good improved with this phosphoric acid. Then phosphoric that is especially in sarcoma, so the pain of the cancers. And associated symptoms are mental debility first, then physical. Then muriatic acid, especially having action on muscles, heart, anus, mucous membrane, digestive tract, mouth, tongue, and brain. Pathology produce septic condition, that is decomposition of fluid. Sensation, as if brain was clasped by the hand. Then associated symptoms is mental sadness. That is the important associated symptoms of muriatic acid. Then fluoric acid, especially having the action on fibrous tissues, veins, skin, bone, and mastoid. And the main pathology that is occurring acts upon the lower tissues indicated in deep structures process, that is endosarcoma. And the sensation as if burning vapors was emitted towards the whole body. Heat of the room, annotation by rapid movement, and especially emaciation, caries, and necrosis of the long bones. Then oxalic acid, especially having the action on digestive tract, navel, nerve cord, heart, lungs, and left side. That is, pathology is influence the spinal cord and produce motor paralysis. And mainly associated symptoms are spasmodic symptoms of the throat and chest. And picric acid, especially having the action on nerve, brain, cord, lumbar region, kidneys, and sexual organs. And especially pathology, it is indicated in condylomatas, and associated symptom of the patient is cachectic emaciation with burning along the spine. Next, another one important group of medicines that we have experienced in our palliative care department is with the Cali group medicines. Cali group medicines is also one of the important group of medicines that we have experienced for this oral cancers, especially Cali carb, Cali sulf, Cali mute, Cali arts, and Cali cynatum. So the Cali family is made up of protection which deals with profound muscular weakness and eventually paralysis, latitude weakness, affects markedly the mucous membrane, producing congestion, inflammation, ulceration, and increased and altered mucus discharges, and for hemorrhages and cancerous diathesis. They produce edematous swelling, twitching, jerking, and coric movements and convulsions, stitching, shooting, tearing, and wandering pain. They have a tendency to produce papular and pustular eruption, unhealthy, unrefreshing, and indolent ulcers. Especially Cali group medicines are the next group of medicines after acid group. We have experience with, especially in oral cancers, this Cali group of medicine, especially Cali cynatum, Cali carb, Cali sulf, Cali mur, and Cali as. And also many oral cancers we will be also advising for this hydrangea, this what uh, mouthwash also outcome. So palliative care with homeopathy in cancers satisfied the aim of pain management, improved the life expectancy, allowed for a decent death. This is the important outcome that we have experienced in our palliative care department. Palliative care with the homeopathy in cancer have satisfied the aims of pain management and improved the life expectancy and allowed for a decent death. And uh, once we have even thought of there is an increased death is happening in our but usually what I felt is uh, it is a very tough situation to face the that we have seen even uh, with the young age people suffering from cancer. But still, what satisfaction is many of the bystanders have thanked us. Not it is not an credit I am telling, but have thanked us that we have provided them the best level of treatment. That is the only expectation what we have got from or we have experienced from this type of cases. And suggestions to set up a palliative care unit. If you are setting a palliative care unit, the facilities needed in the palliative care unit are separate counseling rooms, inpatient wards, pharmacy, reception and record room, and ICU setup. That is important. Terminal care management equipment with other supportive measures, physiotherapy, psychotherapy, and counseling. Then lab facilities with ECG, X-ray, USG, etc. And we have to have an 24-hour separate ambulance services and the emergency homeopathic medicine kit. That is a very important thing we have to before setting an palliative care program, because we have to sometimes we have to give some medicines even to the patient itself, a kit, because night and all sometimes the patient may be calling and telling that my I'm suffering from these and this, but you should have an emergency medicine kit always in your palliative care department. And home visit services, it is very important because many of the patients are we are somebody maybe not be able to move and all immobile patients are there, so it is very essential to do this home visit services and separate night duty doctors and nursing staff, trained nursing staff in this palliative care. So you in my time limit, just I have made an aim to That's what is the palliative care. And finally, thanking you one and all for giving me an opportunity to present. Thank you.